Welcome back to my channel, Navigating Midlife Live. I think all the topics I talk about are important, but menopause and snoring, why does it happen and what can you do? And this can be embarrassing when somebody tells you that you're snoring suddenly. It can really affect relationships, most definitely. Because we know, as women, we know if we have a partner that's snoring, we don't like it. And then all of a sudden the tables turn and they don't like it. Um, is this something that is just part of menopause or are there other reasons? And it's a mixture. It's definitely a mixture. And as I say, it can be embarrassing, and where do you start as a woman snoring? Because, a lot of times, well, women don't do that. We're feminine and sweet and, we always smell pretty and all those kinds of things, right? But the reality is, physiologically, we definitely can have these issues. So when you go to a doctor, or, you could be embarrassed to talk to your doctor about it. And the other part is if you're single, how do you know you're snoring unless you have somebody to tell you that you're snoring? So that's I'm going to talk about snoring today, why it happens in menopause. I'm going to also talk about things that can be affecting it. So not just physiological, but also there can be a relationship to food, to stress, and what are some of the things that you can do about it to, yeah, hopefully not snore. It's a tough one. So let's get started here. As I mentioned, there's a lot of women that, yeah, they never snored before, and all of a sudden they start snoring. And sort of funny story, my ex-partner and stepson heard me snoring one night. So I would have been in the very early stages of perimenopause in my early 40s, and they recorded me on a little tape recorder because back then, the phones didn't do that stuff. So they recorded me on a little tape recorder because they thought it was very funny and they wanted to prove to me that I was snoring. And sure enough, I was. But I just tossed it off to, I think I'd been traveling and I was just really tired. And so I passed it off as just being really tired and the way that I was sleeping. And I also used to get quite stuffed up when I would do a lot of travel, a lot of plane travel and stuff like that. I'd get stuffed up. So that's what I equated it to, was that, I was tired and I've been traveling. Anyway, they had a good giggle about it, especially when they were playing it back to me the next morning. But I never related it to perimenopause and to the changes that I was going through and how my hormones were changing. And so, yeah, I honestly just tossed it aside. And the subject never came up again. So I thought, okay, well, it must have just been that one time. But perhaps I was doing it more times and my partner never mentioned anything. And of course, after that, somebody that I was dating mentioned it to me as well too, and I'm like, okay, I'm snoring, but I never related it to menopause. I didn't know who to talk to. I did go to a doctor, and they checked out all my airways and everything, and they said everything's normal. We can't find anything. I'll share more about that later when we talk about the things that can absolutely be affecting why you're snoring. So let's start with hormones and progesterone. So progesterone stimulates our breathing during sleep. And as that progesterone starts to drop, as I've mentioned before, through perimenopause, progesterone starts to gradually go down. So as that progesterone starts to drop, that can change our breathing patterns. And so, that can be part of the effect. The other part of it, of course, is the estrogen. As we know, our estrogen changes during perimenopause and then, of course, into the other stages of menopause. And estrogen can be going up and down until it sort of finally sort of flattens out at that point when we go through the menopause, that 12 months of not having your period. And then we know we're officially in menopause. And so estrogen, of course, at that point, just sort of, I would say, flattens out, and it gradually starts to decline a bit more as we go deeper into postmenopause. But what do we associate estrogen with? We associate estrogen with elasticity in our skin, helping us maintain the collagen levels. Well, what happens when we start to lose collagen? Well, things start to relax. They're not as tight. We know that our skin isn't as tight as we go through the stages of menopause. And I'm just going to put a quick caveat on here. Now, these things could be completely different depending on the type of hormone therapy you're on as well too. Okay, so I want to add that in there because some women may not experience it, and that doesn't mean that the women who are, there's something wrong with you. It just means that physiologically you could be experiencing these changes differently than a woman who's on hormone therapy. And I'm not saying go out and get hormone therapy. I'm just saying there can be a difference. Okay. Well, what happens? Well, our throat muscles, all of those can start to relax a little bit more, when we're sleeping. And this can be part of position. It can be part of all of these changes that are going on with the changes in the collagen. But when we're sleeping, our jaw can relax more depending on the position we're sleeping in. And our tongue might sit differently in our mouth as well too. And I know a lot of people that wear mouth guards at night to protect their teeth because they grind or they clench. Well, add that into the scenario, and now you've got all of these changes physiologically going on in your mouth, in your throat. The other part that can happen is as our face starts to relax a little more, as I've seen this over the last few years. My cheeks are a little lower than what they used to be. And when I think about that, that has slightly affected my breathing, my nasal passages, especially within these lower sinus cavities. And so that's where, you might want to use those breathing strips. They might help, they might not, hard to say, but we do get some laxity in here that's starting to happen, right? As it all moves down. It's just the reality. And of course, as I've shared, I was not able to take hormone therapy, so I'm navigating all of this naturally. And so this is why I share all these things with you, because I see what's happening with me. So to give you some insights. So those are some of the things that can be happening. As I mentioned, sleeping position. So do you sleep on your back, and what kind of pillow do you have? Is it one that kind of props your head forward, or is it one that, allows you to lie flat, or, does it have a bump in it where, again, person that I was dating, he heard me snoring and insisted that I go out and we bought one of those, contour pillows where, my head, I guess, was in a certain position that my breathing was better. He said it helped me not snore. So I'll just go with that. But so breathing, the sleeping position and how our breathing is working while we're sleeping can be part of the issue as well too. Do you sleep on your side? Depending on which side. Are you a belly sleeper? All those things. So these are things that you want to take into consideration. The other part that can affect us is, of course, and we know this with our partners, if they've been drinking, do they snore louder? Well, that can happen to us as women as well too. That glass of wine, can relax those muscles even more. So that can, further amplify the snoring. But another part that we don't always think about as far as how we're breathing is the foods that we're eating. And I've talked before about foods that cause histamine increase. And of course, as our estrogen drops, it is a regulator of our histamine, so our histamine can increase. So if we've had foods that have increased the histamine levels, that of course can increase the stuffiness in our passageways, our breathing passageways. So that's another thing to take into consideration. Now, a lot of times, weight will be the main the main thing that's blamed on whether you're snoring or not. So if you go to a doctor and they say, well, have you gained weight in the last number of years? And if you say yes, which of course a lot of women do struggle with this, trying to figure out how to maintain their weight now that they've gone into perimenopause and beyond. Well, don't let that just be a way to sort of let things go, that, oh, well, you put on weight, that's why you're snoring. Well, okay, that's fine. Maybe the weight distribution has changed, but that's still not a reason to just dismiss why you're snoring. Because here's the other part of it is that, you know, the reason with you snoring, this should be checked out because potentially you have maybe light sleep apnea, something like that. So we don't want to just assume that this is just a noise that we're making now. Is there could be other things that are being affected in our body. So this is where if you're waking up and you're super tired the next day, even though you feel like you've slept well, but you're really tired. Let's talk about that weight gain again for a second. Sleep apnea has been correlated to weight gain. So this is something that we don't want to assume that it was the weight gain that caused the sleep apnea. Maybe it's the sleep apnea that's causing the weight gain, along with everything that's changing in our bodies while we're navigating those stages of menopause. Stress, as I mentioned, I chalked my snoring up to, being stressed, traveling, all that kind of stuff, being really tired. Yes, stress can have an effect on, how we're breathing, how we're sleeping, and that could cause the snoring. But again, there is a hormonal connection here. And of course, the other part that comes into it is the effect on relationships. And as I mentioned earlier, if we have a partner that snores very loud, my ex-husband was a very loud snorer, to the point where he actually, like, he would shake the bed because he was breathing so hard. But he absolutely refused to go and get anything done about it. Nothing I could do. Wasn't the reason why we broke up, but it was so loud sometimes that I would actually have to leave and go sleep in the next room with the door closed to not hear him because he was such a loud snorer. And so this can affect our relationships, that all of a sudden, you've got somebody moving to another room because, one person is a very light sleeper. This can really start to affect the overall connection within the relationship. And there's so many things going on that when we enter perimenopause and, go through the other stages, that it can just be one more thing that can kind of tip the cart. And now you've got a really unhappy relationship, and you're not even sure why. You're taking on all of the, I guess, blame or fault for your snoring and, the changes in your mood and everything that you're feeling that's changing. And yet you're so confused yourself as to why all of these things are suddenly happening to you. And where do you start? Where do you make the changes? How do you stop all of this? Or how do you deal with all of this? So it's really important that, this is something that is discussed between you and your partner of how do you solve this situation? And again, it shouldn't be something that's dismissed by your doctor because there could be overall health issues that could come along with that as well too. So we know that breathing issues at night can bring on a whole host of things like not just sleep apnea, but it can increase your blood pressure, as I mentioned, your weight gain. Uh, then talk about brain fog. As it is, we deal with brain fog when we're going through the stages of menopause. And if we're not breathing properly at night, we're not getting good sleep, that further adds into our brain fog situation. So I know I'm being, very negative Nelly here at the moment, but I feel it's important that all these points be brought up because there are ways for you to go to your doctor and talk about what's going on, talk about what you're feeling, and talk about solutions, but also not just looking at the physiological side, but also looking at the nutrition side. Where do I need to make changes? Am I eating a lot of foods that are causing a histamine reaction? Um, you know, if I slow down on the alcohol or not have alcohol, will that change it? Will that make my breathing better so that I'm not snoring at night? So there's all of those things. The other part is we know that when we exercise, not only is that building muscle, but the ways that we're breathing, uh, you know, uh, when we're, especially when we're lifting weights or when we're running, even doing yoga, we know how important breath is. So having mindful breathing is something that can also help with, helping to keep everything in better shape, more active. If we're at a desk job and we're constantly, doing very shallow breathing, I am guilty of that when I'm working on something. And that's where, maybe doing some additional breath work could really help. And as I say, that connection to exercise. When we're running, we're breathing. When we are lifting weights, we're doing very specific breathing to support that. So all of those things can support us and they can help us. And of course, we know how much exercise can help with respect to reducing stress, helping us sleep better, those types of things. So there's multiple benefits when it comes to those types of things. So what can you do with respect to, as I mentioned, there's things to talk to your doctor about. Now, there's also, and I don't know if you need a recommendation to go into one of these clinics, but I have seen a ton of, they're not sleep clinics, they're sleep apnea clinics, or you can get these contraptions. I don't know I think if you get a doctor's note, you don't have to pay for it. I don't know if they charge a fee for you to rent them out or whatever, but it's this contraption you put on your head. I used one because I wanted to know what was going on. Did I have sleep apnea? And getting an overnight sleep test is a long waiting list. So I wanted to know what was happening to my body. So this thing, it records how loud you're snoring, the decibel rating. It records, like how often. It shows a pattern of how often. Of course, I don't know if it can tell whether you're sleeping on your side or your back, but it's the way it is. It's pretty difficult to sleep on your side. You pretty much have to sleep on your back. But it also records oxygen levels as well too, which is important. Now, these give you an idea of where you're at, but they only have a certain level of accuracy. If you want something that's really accurate, that's where the overnight sleep test is going to show more, because they're monitoring you all night long. They're putting, those little things that they stick on you. And they're monitoring everything in a far more precise and detailed manner than what this thing that you put on your head does. So that's what I would recommend, that if you suspect that this is something that is quite bad, that you do request that from your doctor. And again, we can always say, look, I'm experiencing these changes and it is affecting my quality of life. I'm not able to show up the same way at home, at work. We have every right to say that, so that the doctors don't just dismiss it. All right. As always, I always make notes because again, these topics, they're important to me and I want to make sure that I'm covering everything. So let's just see. So I talked about sleep position. See, a point I knew I would miss, and this is something that I don't think about: nasal breathing. If we breathe through our mouth, there can be more of a chance of snoring. Now, I'm one of those people, I can snore really well just by nasal breathing. My mouth, I do not breathe through my mouth, and I know that. I've never used the mouth tape, but I know that I'm not breathing through my mouth. I am solely breathing through my nose, and I managed to snore really well. So this is where as well too, I had, is there something going on with my tonsils, my adenoids? Did I have some sort of growth in my sinus cavity that was causing these things? So I had all of those things checked out. And no, it's just purely how my physiology has changed, with the changes in my hormones. That's just my reality. But this is something that, training yourself to nasal breathe. I'd be careful with mouth tape because for some people it can be very claustrophobic. And if you have sleep apnea, mouth tape is not a good idea to try to start nasal breathing. So I'd be very, very cautious with that, even though, it's a trendy thing to do. Okay, so let me see. Yeah, so, things that, where snoring shouldn't be ignored, some of the things that you could potentially feel, of course, persistent loud snoring. And the only way you're going to do that if you're single, you don't have anybody to tell you that. But if you have a partner, your partner, of course, is most definitely going to do that. If you're single, something that you can do is actually turn your phone on at night on an app that records sound, and then you can actually record yourself through the night to see whether you're snoring or not. I've done that at different times where I've changed habits, changed certain foods that I thought may be causing issues, and I'll record myself just to see whether I'm snoring or not. So that's something that you can do if you're single. Um, Waking up with headaches, waking up feeling lethargic. And as I mentioned as well too, if there's issues with blood pressure, if you've had weight changes. Another thing that somebody shared with me, I don't know if this is completely accurate. I haven't researched it, but they said that they found they were diagnosed with sleep apnea. So they got the contraption that you put on, CPAP machine, and they found that their eyes were less red the next day. So they would wake up with bloodshot eyes when they were snoring and their sleep apnea was really bad. But once they went on the CPAP machine, they found that their eyes were much clearer, that the whites of their eyes weren't as bloodshot. So if you're waking up and you're seeing that your eyes are really bloodshot, you think overall you've had a good sleep, maybe that's something to also mention. So we never know, right? Things can be dismissed as being, fallacies or I don't want to call it conspiracies, but unproven theories. But hey, as far as I'm concerned, if somebody doesn't feel well, anything that you're seeing that's changed within your physical body, to me, that's all a symptom of what's happening, and it's worth mentioning. Okay, so is there anything else I want to mention? I don't think so. But what I'm going to do is, because I mentioned histamine, I'm going to link the video that I did on estrogen and histamine. And there's actually a handout or a document that you can request and download that has swaps of food with high histamine foods to low histamine foods. And I included some recipes in there as well too. So if you're snoring, you're not alone. There's a lot of us women out there. And I will share one more thing before I end this. It is one of the things that when I meet somebody new, I'm really nervous about, because it's like, oh gosh, they're going to want to sleep with me and I'm going to snore and they're going to think, oh my God, what is this woman? What's wrong with her? And that's the reality, right? As we get older and as we're dating, these are the things that come up. So, that's where I ask, are you a light sleeper? You know what? I have to laugh about it. That's the only way that I can handle these things. There's nothing I can do to change it. I can only laugh about it, make the best of it, and hopefully one day I find that incredible man that says, it's all good. I love you too much to worry about that. So anyway, I'm leaving on that note. So thank you very much for joining. And I'm going to pop this up. Please like and subscribe. It really helps my content be seen by more women. I feel that all the information I provide is just good, logical information. It's information that every woman should have access to, who are women who are going through the stages of menopause, and even younger women if they're curious as to what this transition is going to be like. So thank you very much. I'm really glad to have you here, and I feel honored that I can share all of my knowledge with you. Have an awesome day, and I will be back again next week. And once more, please like, subscribe, comment, share, and I'll see you again next week. Bye-bye.